Good evening, everyone. This is Supervisor Boddye, Occoquan District Supervisor. Thank you so much for joining us tonight for our virtual town hall post-budgets. We will be covering a few different issues tonight, including our COVID response as a county, as well as some of our human and social services. I am joined tonight by Courtney Tierney, Brian Misner, and Lisa Madron. Brian is the head of our coordinating efforts for our emergency response. Lisa Madron is the executive director of our community services, and Courtney Tierney is the head of our social services department. Before we get into the nitty gritty of this presentation, I just had some brief highlights to share in terms of resources and some other issues in the community that we have at your disposal. Yes. So first up is this slide you see before you, some general resources for folks that need help. We have the Prince William Health District Call Center, which is sort of the general call center for folks that sort of have questions and issues for our healthcare providers and our healthcare system, whether it's COVID related or any other issue, but especially if you're experiencing symptoms or you just want to get a feel for how our health system is responding to the crisis, you can call 703-872-7759. We also have the Prince William Area Disaster Relief Fund, which is a relief fund that was set up by our county in partnership with our community partners a couple of weeks back, which is a fundraising mechanisms to get funds and resources to the various nonprofits in the area that are really helping out to feed folks, house them, provide them with hygiene products and all the necessities that they need to weather this crisis. You can text IMPACT, IMPACT, to 36413, or you can call at 703-344-4729. And 50% of all the proceeds for the Prince William Area Disaster Relief Fund go straight to the Community Feeding Task Force. That said, the Community Feeding Task Force is a coalition of various nonprofits in the area that have come together to prioritize getting folks the food they need. Obviously, the school system is doing an excellent job feeding our school-age children. There's a lot of adults and outside school-age juveniles that need hot meals and other nutritional needs, and the Community Task Force is doing an excellent job doing that. ACTS is one of the head lead organizations on that. They have reprogrammed parts of their food rescue app that everyone's familiar with to help in this endeavor, and you can reach out to the Community Feeding Task Force either for help or to assist them at 703-794-4668. So how can you give back? We have a lot of able-bodied, high-experienced, highly educated folks here in Prince William County and the Occoquan District. So if you fall under one of these categories, we ask that you volunteer if you have some time on your hands. If you have medical experience, for example, you can volunteer with the Medical Reserve Corps with the Prince William Health District. And you can reach more information on them at www.vdh.virginia.gov/MRC. So again, if you have medical experience, we ask that folks go and sign up with the Reserve Corps. We also have Volunteer Prince William, which they're doing more generalized volunteer work, outreach to the community, really helping folks get connected to resources. They are in very high need of bilingual volunteers who speak Spanish and English for their feeding task force. So you can reach them at volunteerprincewilliam.org, and general Prince William County job opportunities, whether it's in the medical fields, social services, human services, some of the folks that we'll be talking to shortly in terms of the departments that have ramping up their efforts to help folks out. You can go to pwcgov.org and click on job opportunities. As always, my office is here to serve you, even though our office has been serving virtually for the past month or so. We are still here answering phone calls, responding to emails. So please reach out to us. OccoquanDistrict.net is our website. My team has been doing an excellent job curating all of the information coming in regards to the COVID-19 pandemic. whether it's on the state, federal, or local level. And we have a special page on OccoquanDistrict.net to provide resources and information, whether you're an individual, business owner, community leader, nonprofit, regardless of what section of the community you come from, we have resources for you. So please don't hesitate to come to OccoquanDistrict.net. If you want to connect with us directly through our office, you can also email us at occoquan@pwcgov.org. That's our general email box. It comes to all of our staff. And if you have a general question or you're not sure which member of our team to email, just email that and we'll make sure it gets divvied to the right place. Also, please subscribe to our email updates, which is at occoq.org/email. We have an email newsletter that we've been sending out periodically, and we've only ramped up the frequency of that in response to this crisis. So please sign up if you haven't already. And if you have, but you haven't been receiving emails from us anyway, some folks have been experiencing spam folder issues, things getting marked as trash, things like that, depending on the email system you're using. So please look and search your spam folder if you're not receiving our emails. And if for some reason after you search them, you're still not getting emails from us, please reach out to my staff and myself, because we've been sharing a lot of really good information and we're here to serve you. That being said, we had a very productive, if not unprecedented budget cycle this year. We had a very different budget in February that proposed to us versus what we passed a week ago. But obviously we had to respond and rise to the occasion of this crisis. Obviously we experienced a lot of shortfalls in terms of state, federal, and sales tax revenues. And it not only affected us in our current budget season, but our future FY 2021 budget season, which is the one we approved last Tuesday. And so we had to make some very strategic and hard decisions. But we all agreed, regardless of where we were in terms of our ideology, that we need to make deep investments in our social services, our community services, and all those general human services that are not only helping us weather this storm, but will be integral to making sure that folks, as we get out of this, are served, are fed, whether it's our homeless population, our unsheltered brothers and sisters, folks dealing with substance abuse, mental health crises, folks in the juvenile and adult detention facilities, and all of everyone else that's been falling through the cracks for quite some time. We believe that we make those investments now, we will better serve our community moving forward. So that being said, I'm going to kick this off to our folks that joined us tonight in our town hall, and I'm looking forward to a really great conversation.
Structure that are present here in our EOC, and our structure is flexible and adaptable, and that's certainly what we've been doing in recent weeks here as we've assisted the community through this effort. A couple key principles that I want to focus on is that our EOC structure lets us have unity of effort in what we are focusing on. So everyone reports to one other person, and we make sure we don't have any information that gets lost in translation. We've implemented a single point ordering system, which I'll talk a little bit more about here later in the presentation. And then we have joint public information, which means that in terms of anything that we're releasing to the public, it's all coordinated through our joint information center. And that allows us to have a clear and consistent unified message out to the community. The timeline of our response efforts and really our preparedness actions have been a continuous process. So our emergency operations plan is a living document. It's all hazards in nature, so it prepares us to deal with any hazard we might face. Certainly, we are more used to activations that are a couple days long for something like a winter storm or a tropical weather system or a damaging wind event. We're going on week 8 now of this response operation, so certainly is one of the longer operations in my career, and I think probably the longest emergency event that the county has been through. But it has been a continuous process that led up into us sending our initial public information out in January. The county executive directed some activation of part of the process in early March with a policy group to inform him and his senior leadership. We then virtually activated our Emergency Operations Center on March 8th. The next day, activated the Joint Information Center and Government Liaison Officer. And then as the situation deteriorated, Virginia declared a national emergency. The president declared a national emergency. Our EOC was fully activated. with the county executive declaring a local emergency on March 16th, and then the state health commissioner declaring a public health emergency on March 17th. So we've really been in a very similar operational stance since that mid-March timeframe when we fully activated. The team here in the EOC and really the whole community and the whole government effort have been working around the clock, communicating 7 days a week, typically meeting multiple days a week. We've always got at least one person on call after hours, if not multiple folks up doing work late, to make sure the community's needs are being met. Some recent EOC planning efforts I'd like to touch on that we've had lots of great success with in coordinating. The first and foremost has been supporting our partners in the Prince William Health District, which is ESF 8, and you'll see throughout the presentation, ESF stands for Emergency Support Function. So that is that functional approach to our EOC that I was trying to show with the breadth of that org chart there at the beginning. We've been focused on the healthcare community and supporting their needs. They truly are on the front lines in terms of our first responders as first receivers, going out to folks' homes and businesses as they might have a medical issue, and then transporting them to a hospital for definitive care. And also some of our healthcare professionals and workers that are in long-term care communities and other settings, which are particularly vulnerable. So we've been supporting the health district with any needs that those folks may have when it comes to personal protective equipment, information coordination, etc. We have worked through the process with our state counterparts to send letters to FEMA for approvals on hotel accommodations for persons experiencing homelessness under an order of isolation or quarantine, or for those who are homeless that might be a bit more medically vulnerable. And I'll let Ms. Tierney expand more on that during her remarks. And then that same approval process now has also been extended to first responders and healthcare workers. So if we have a member of our county or volunteer staff in the fire rescue system, or law enforcement officers that have been exposed to COVID and for whatever reason don't feel safe going home, if they got a family member that's medically fragile or something like that, we're also able to accommodate them in a hotel so that they are able to not bring that home to their family. Another great success story, as Supervisor Boddye mentioned, is the Prince William Area Disaster Fund. Really excited to see the effort that came together on that fund. We certainly get support from a lot of the large national focused charities here in the community, but this fund truly is community focused, and 100% of the funds raised go back directly to needs here in our greater Prince William area. So we've been very excited to see that come to fruition. I mentioned briefly the single point ordering process in our emergency operations center. We had it on the books and had done some testing of it, and it was really meant to address several weeks of a need for recovery from something like a hurricane or an extended winter storm of power outages. And I'm very pleased to report that we've successfully adapted that process. It's been operating, of course, 8 weeks now, and we're planning well through the rest of the year as needed, focusing on personal protective equipment and disinfecting supplies. So that's been another great success for us. And then the highlight, I think, certainly also would be the community feeding task force. So Supervisor Boddye mentioned the community kitchen there in Occoquan is part of that task force. It's one of the sites that works through our hub and spoke model to receive some of the bulk food donations that the task force gets in from food service providers. I believe we're up to 43 different partners now between the spokes and then the additional partners that are receiving commodities from the spokes. And they've done well over 200,000 pounds of food donated out. So again, very happy to see the process with all of our community partners and our partners in the cities of Manassas and Manassas Park that were able to come together with the county and make this work for everybody. So as of 10 a.m. yesterday, and had hoped to have today's data, but the state had a bit of an issue with their reporting system, so we don't have state data yet today. So as of yesterday, statewide, there were 20,256 cases of COVID confirmed by a laboratory in the Commonwealth of Virginia. In the county, we're currently sitting at 2,223 cases, of which there have been 225 hospitalizations, and unfortunately 33 of our community members that have passed away as a result of the virus. In Northern Virginia, there's just under 11,000 cases, and in the National Capital Region, there's almost 32,000 cases. So by comparison, there's 20,000 or so cases statewide and almost 32,000 in the NCR, which is why it's important for us to be coordinating with our colleagues and partners in the District of Maryland. And I know that the governors and the mayor of DC are coordinating to that effect. and our chief administrative officers here in the region are also coordinating efforts to make sure that we're all unified in our processes and procedures for slowly trying to reopen certain services that were not deemed essential, so that we don't do too much too quickly. Looking ahead to some of the active planning efforts that we're still undertaking here in the EOC as we look towards the recovery phase of this incident. We are still supporting the feeding task force, looking at a little bit larger of a facility to serve operations for several additional months. We have also, at the request of our health director, Dr. Ancher, worked with them to initiate a community testing task force. One of the important functions of the reopening process is going to be the ability for an increased amount of testing in the community, as well as contact tracing by the health district to address any small pockets of issues or exposures that might occur. So we're supporting the health district with their request for that task force. Our economic development team has stood up a business recovery task force to serve as a clearinghouse for resources that are available to the business community. And they've also been working to aggregate information about the various recovery programs that individual business owners may be able to apply for. We have stood up a election support task force here in the EOC to support the general registrar with any needs they may have for the upcoming town and primary elections. Some examples would be that our buildings and grounds teams have been constructing some plexiglass shields for the various stations and counters that are going to be in each of the precincts. And then the EOC, through our logistics section, is making sure that we've got enough protective equipment, gloves, face coverings, etc., for the team that's going to be working in each of those precincts. Specific to our Emergency Operations Center, some of the novel things that we have stood up to adapt to the nature of this being a pandemic and a little bit outside the box of just a couple weeks long activation. First and foremost, a disinfecting task force. So we've got plenty of supplies on hand, and we've been fortunate to receive some additional specialized equipment that's more effective at rapidly disinfecting larger areas or areas where there's a higher risk of there having been an exposure, like the back of an EMS transport unit, for example. So we've stood a group up that specifically looks at needs for more detailed disinfecting of areas in county facilities or vehicles. We have an internal team that is meeting, taking a look at our county operations and giving recommendations to the county executive and leadership about which functions might be reopened first and what the health district would indicate we need to be doing in terms of community testing capacity, contact tracing capacity, and measures, both from the health district and then from any orders that come from the governor. And then finally, we've been working inside the EOC with our finance section to track all the different recovery grants that might be available to the county to help us offset some of our expenses we've incurred with the response to the pandemic. Supervisor Boddye mentioned the majority of these resources already, but just one last item to note. If anyone is interested in signing up for updates on county operations, there's two different keywords. You can text COVID PWC to 888-777 for English, or COVID PWC ES to that same number, 888-777 for Spanish. And with that, that's all I have prepared, and we'll be happy to answer any questions.
Thank you, Brian. That's all very helpful. Would you be able to share this slide deck with us after this is over so we can have it, send it to the folks out there?
Yes, absolutely.
Appreciate that. Yeah, we're going to be opening it up to questions now. If you are with us online, you can go ahead and type your questions into the chat, and we will be able to answer them for you. And again, this is just on Brian's section. We will get to Courtney and Lisa here. And I do see that some more folks have joined us, so welcome to those who have joined us since we started. I am not seeing. There we go. We just got a question from Jason, who works in my office. We asked a really good question. Is it possible to report COVID cases by zip code?
Yeah, that's a really good question. We know that some other partners in the National Capital Region have been reporting in that way because we are a Commonwealth and because of the way health information is protected by state law in the Commonwealth. The Virginia Department of Health is the lone resource and authority for reporting case information. So what they put out publicly on their website is the only information we also receive and that we're authorized to share. We have heard that they are looking at some additional ways of sharing more information. So we're hopeful that that may be something that occurs in the future. But it is just important to note that we continue to be in community spread here in Northern Virginia. That is part of the messaging and the reason why the governor elected to extend Executive Order 53 through next Thursday. And then we'll be taking a very slow incremental approach. So social distancing and good hand hygiene and wearing face coverings are still going to be part of our daily life here for a little while. And that's really the most helpful thing that the community can be doing to help us still limit the spread as we edge toward recovery.
Oh, yeah, thank you for that, Brian. Yeah, I know. And that question was actually from Mr. Brian Blankenship. So thank you, Mr. Blankenship, for that question. I know that some folks have been curious about having more drilled down reporting and just wanting to know what parts of the community have been more impacted than others. And for safety reasons, obviously, parts of the community that folks should be sort of keeping a little bit more cautious of and what have you. But obviously, we're all in this together. And as the Northern Virginia Prince William community, we're still obviously dedicated to making sure that everyone gets the help that they need. So let's see. Any other questions for Brian? There's another one here in a second. All right. From Brian Mealy, and I apologize if I mispronounce your last name. Are there needs or opportunities for communications and outreach support for experienced crisis/risk communications professionals for media interview, coaching, or other supports?
Yeah, it's a good question. So we're very fortunate that we've got a great communications team here in the county, and our executives are very supportive of our structure and process. So we have implemented our Joint Information Center very early in the process. Certainly, though, we'd be happy if there's any opportunity to make a connection. So resource COVID-19 offers at pwc.pwcgov.org. So Mr. Mealy, if you just want to reach out with your information, I would be happy to at least make the connection with the communications team should they have any unmet needs.
That's a great point. And yeah, I mean, obviously right now, we are obviously going through the process of seeing not only what we're doing right now to help folks make sure people get tested, people get treated, what have you, but obviously as Brian alluded to before, as we get closer to phase one, as the governor has been calling it next week, obviously we're going to have to outreach in the community even more to make sure folks know that obviously as we get into phase one, this isn't just completely opening everything up. This is a very deliberate, careful way of being able to get things a little bit closer to normal. So outreach and communications will be very important. So and I know that Brian, your team's definitely on that. So thank you again, Mr. Mealy, for that question. Any other questions for Brian? So if anyone has any other questions for Brian after we wrap up here, please feel free to reach out to my office. We're more than happy to reach out to Brian and his team. I know that sometimes folks might look at this later actually also because we will be posting this recording online once this is over. So please reach out to our office. And Brian, thank you so much for all that you and your team are doing. I know that our emergency response folks have been working day in and day out. I know that folks, you and your team have not had any sort of break days or sick days or days off. I would imagine you guys haven't been sleeping very much either. But it's a testament to all of you and your team that you've been able to be very effective and very lean in getting us through this crisis thus far. And Mr. Mealy actually just sent a kudos to Brian and his team. So obviously the community is behind you 100%. Thank you again so much, Brian. Appreciate it.
Thank you very much. We appreciate the community support and the board support. It means a lot to the team. So thanks, everybody.
Thank you. So now we're getting into some of the nitty gritty, the guts of what the county is doing to actually help folks, not only more generally, but especially during this crisis. We have a lot of dedicated staff on both the social services side and community services side that have been helping tons and tons of people. That's only ramped up even more. It's our unsheltered community, folks that need food, folks that need Medicaid applications, process and what have you. And at this point, I'm going to stop talking and let one of the experts talk about it. So Miss Courtney Tierney, the floor is yours.
Thank you. Hello, Occoquan, and thank you, Supervisor Boddye and your great team, Emily, Jason, and Julia. It's a pleasure to be here. I was particularly honored to be with my co-workers, Lisa and Brian. I would like to say Mr. Mealy, who had a question about volunteering with communications, I may know of someone that could use those skills. So my contact information is at the end of this, and I'd be happy to explore that further. So let's talk about the Department of Social Services. I'm going to take the control now and hope that I can move the slide. So, sometimes, there we go. In human services, we transform lives. And in DSS, as one of the local human services departments, we transform lives through safety, support, and self-sufficiency. These are the divisions that we have in DSS. We do a lot of different work, and we divide it up under safety, support, and self-sufficiency. All of the services that we provide are essential, and all of the personnel are essential as well. So we're all working even through COVID. So let's talk about safety first. Child Protective Services and Adult Protective Services are very important for our community. During COVID, we are having a decrease of reports of Child Protective Services. This does not mean that there is less abuse and neglect of children going on. But unfortunately, because the schools are closed, they are our biggest referrers. So we are not getting the reports that we normally would. So I would encourage all of you to keep an eye out on the children in your neighborhood, the children that you know, families that you know, and please report. The numbers are here. For Adult Protective Services during COVID, we are seeing a 20% increase in the need for adult protective services. So these workers do go into homes. They're often the first responder there into the home, and we look to the community to help us to keep our vulnerable citizens protected. During the COVID response, we are doing it virtually. There are home visits being made. They do ask the questions before entering. They are using PPE. Our court visits are still occurring as needed, although the court system is sort of ratcheting down a little bit and delaying some things. We are figuring out what to do regarding children who may need to be removed from their home in need of quarantine or isolation in case one of their parents or both parents are very sick from COVID. It would be difficult for some foster care families to take in a child even temporarily if that child needed to be quarantined. So we are working through that, and we are going to talk about homeless services and what to do regarding adults who are homeless. In the budget this year, and we thank the Board of County Supervisors very much, they put in $175,000 of local general funds to match some state general funds so that we can add 6 positions in Child Protective Services for an evening and weekend team. This will be very helpful. You can imagine this work is difficult, and after a long day of being in court, working with families, when you're on call and you're getting ready to go home and that phone call happens and then you're out another 12 hours, that can be very difficult, and it is a difficult thing to retain workers because of it. So we will now be able to put in a new team. The board also appropriated $125,000 for the exploration of a child advocacy center, which is for independent interviewing of children who may have been sexually or severely physically assaulted. And this will aid in prosecuting offenders. It'll support the family and the child, and it will educate the community about child abuse. In our juvenile justice programs, the Department of Social Services operates the pretrial supervision program, the juvenile detention center, and the Judge Patrick D. Molinary Shelter for Youth. The pretrial supervision census is going up because the court is not detaining and keeping children as much during this. And so the census at the JDC and the Molinary Shelter has been going down. We also serve the cities of Manassas and Manassas Park, and we have a program for children that are in state custody. State commitment is the real word, and they are also located at the JDC. We are in the capital improvement plan for a trauma-informed design for a JDC. The original building was built in the 70s. As you can imagine, these are residential, the JDC and the Molinary shelters, so we need to make sure during COVID that we are very, very clean. We are socially distancing, which is not an easy thing to do when you have a bunch of teenagers. But they are doing a great job of it, using PPE, masks, and so forth. We are canceled non-essential visitation. This can be very difficult for families, and we understand that. So we are increasing the telephone visitation that they can have. Our pretrial supervision does go into the homes. In the community, they must lay eyes on the child that has been court ordered into pretrial supervision. So again, they are wearing PPE, going out, doing virtual meetings when they can. In many instances, they're standing in the yard just so they can see the child in the front door. In support, we have the Children's Services Act. We have over 500 youth that are served when their medical, behavioral health, developmental, or intellectual needs exceed their family's ability to provide safe and appropriate care. This is being done through telework and mandated meetings. Vendors are being paid when a child is then perhaps sent to a residential facility. And this year, the board budgeted an additional $3,780,886 of local general funds. This is a very expensive program. The total addition will be another $11 million because of the match that we are required to pay to draw down the state general funds. This is primarily a high price based on the education that is required for children with special needs who are not able to be served within the school district. And even though it's education, it is in the Department of Social Services budget. So we certainly appreciate the support there. Our Family Support Services Division does foster care. We have about 105 children in foster care in the community. Fostering Futures, this is for youth that have turned 18. They were in the foster care system. You can imagine going from that into full adulthood is a difficult transition. So there is a program called Fostering Futures from age 18 to 21. CPS ongoing, when we're working with a family, there are some abuse and neglect issues, but the family is willing to work with them, and that can take a lot of time. Sometimes it's called treatment. ICPC is when we have children from other jurisdictions or other states within our community, and permanency, which also includes adoptions. These are all still going on during COVID. There are some things that we have suspended, foster care family training, for example. We are visiting our foster care children virtually. as well as the Fostering Futures. That is working out really well. The youth like it a lot. And so we're hoping that as we move forward, the state might include that we could continue some virtual visits. Court visits are still occurring. And we are, again, trying to figure out what to do. We have not had a child come in who needs quarantine or isolation, but treating that appropriately is something that we are figuring out. And then there's self-sufficiency. Benefits, Employment and Child Care Division. Most people think of that as Medicaid. And we also have SNAP. So stop calling it food stamps because it's really called SNAP. It's not stamps anymore. They have an EBT card, looks like a credit card. Temporary Assistance for Needy Families, TANF, and the employment part is for those that are in TANF and able to receive that. Energy assistance is getting ready to ramp up because of the hot season that'll be here soon, and refugee resettlement. Child care is subsidized with federal funds for persons, families that are in TANF or families with financial need. Medicaid is based on income, and long-term care Medicaid is based on income and health condition. The website there is a good place to start for applications. Sorry that this slide doesn't look right. I should have fixed it. I apologize. We do have staff at the Sudley North Government Center and at the Ferlazzo building on Cardinal Drive. I guess it's on Donald Curtis Drive off of Cardinal near Route 1. We do have staff there to take the mail, take phone calls, direct callers to the right place. We still have to scan documents. When someone drops off an application, first we have to be able to receive it. We have to be able to time stamp it, and then it has to be scanned. We do have a number of workers who are able to telework, and that's working quite well. The productivity is really good, but it is a complicated system. And we do have to be able to issue SNAP EBT cards publicly. And so we are open from 1 to 3, Monday through Friday, at Sudley North and Ferlazzo to distribute those cards. This is done with social distancing being practiced, and the person calls the cell phone, and then a worker comes out and they exchange it. We do have drop-off boxes in front of each building for customers to drop off their applications or any other kind of verifying documentation. We've had a lot of volume with benefits, as you can imagine, during this very difficult time that people are facing. Normally, in a month, we'll get 800 and some SNAP and 200 TANF applications. In the week ending April 3rd, we were at 702 SNAP and 133 TANF just for 1 week. This is starting to go down a little bit, but you can see there, because we don't even have 2 weeks reported there, how much that volume has gone up. Now the state has waived some of the rules. Normally you have to do renewals every year for Medicaid and twice a year for SNAP, but that has been waived so that all of the staff can help process the applications. The board in the budget this year added 6 employees because our volume does continue to go up, and that was $225,228 of local general fund to match state general fund. It usually takes up to 18 months to train a new employee. We are thrilled when we can hire somebody that has benefits experience, but that is often not the case. Homeless Services Division also helps people move towards self-sufficiency. We have a coordinated entry system in the Prince William area. That includes the county as well as the cities of Manassas and Manassas Park. We have a continuum of care for homelessness. All of the providers, advocates, interested parties, the 3 jurisdictions, we all work together. We have multiple meetings. We meet at least monthly, and then there are committee meetings that meet to keep that going. We are required by HUD to have a continuum of care, And the Department of Social Services serves as the fiscal agent as well as the administrative agent. We directly operate the Bill Mayer Drop-In Center for adults experiencing homelessness, the Hildebarg Homeless Prevention Center, which helps families experiencing homelessness, and the Overnight Shelter, which is for adults who are experiencing homelessness. It is a county building and a county program. It is contracted and operated by Streetlight Community Outreach Ministries. And you see the little asterisks there. The Cooperative Council of Ministries and Servants at Work assist with funding and food at those programs. I know there are many churches in the Occoquan district that support this, and thank you so very much. I don't know what we would do if we had to prepare the meals, buy the food, and do all that for the persons at the Bill Mayer, Hildebarg, and the Overnight Shelter. Now, our COVID response for homeless services has been quite significant. Coordinated entry, anyone experiencing homelessness, at risk of homelessness, or needing to be, hopefully we could divert from homelessness, should always call this number, 703-792-3366. That's operational. The Hildebarg shelter is open. The Overnight Shelter and the Bill Mayer Drop-In Center have been temporarily combined and are now open 24/7 at the Dale City Rec Center on Minnieville. We did this because, as you know, we're in the governor's shelter in place order. Well, it's pretty hard to shelter in place when you don't have a shelter. And persons that were homeless were concerned because they had nowhere to go during the day. And so we have now opened that 24/7. Our continuum of care is operating virtually. Homeless staff is on site and are teleworking when appropriate. We also have a homeless crisis response plan that the Board of County Supervisors approved, and we appreciate that, for motel or hotel rooms. It also provides physical behavioral health case management, care coordination, laundry, food, transportation for persons experiencing homelessness who may be COVID positive but don't need hospitalization, COVID exposed but don't need hospitalization, persons that need social distancing. We have several homeless programs in the county that have bunk beds, and that is not social distancing, and that puts persons at risk for COVID. There are a number of people who are high risk based on age or underlying health conditions. And we wanted to make sure that all of these persons had a safe place to be during this. And using hotel rooms is a nationwide best practice, and we've been able to implement that here in Prince William County. So at the beginning of the pandemic, we had 186 beds in the Prince William area for persons experiencing homelessness. For the most part, they were relatively healthy, mostly families. As of May 1st, we now have 328 beds for persons experiencing homelessness of any age and gender and any COVID status. We're pretty excited about that and hope that that will save lives. The board this year in the budget added $500,000 local general fund for homeless prevention. This will start July 1st, and we're working on the rules for that. As the shelter order is lifted, one of the criteria in the shelter order was no evictions. So we are anticipating once the order is up and people have not been able to pay their rent, there may be an increase in evictions. This is not the time to increase the number of persons that are homeless. And so we hope we'll be able to help prevent some of that homelessness. These are some numbers that will be on the website. I'm certainly not going to go through them all, but our hotline for child abuse and adult abuse. There is a number there for the Area Agency on Aging to help persons 60 and older or adults with disability, how to be a foster parent. When this is over, we will start training that again, adoption, homeless services, and public benefits. That's my contact information. Feel free to reach out to me. We are in this together, this COVID-19, and we look forward to all enjoying being on the other side of it, which we're calling DVOC 20, Disease Interrupted, Virus Overcome by County Champions in 2020. So with that, I'll end, and if you would have any questions, I'm happy to answer them.
Thank you so much, Courtney. That was an awesome presentation as always. As folks can see, our human services folks, our social services folks are doing a lot of work in our community. And I just wanted to, I would be remiss if I didn't emphasize how much our investments in this, in a lot of preventative measures really goes a long way. As Courtney said, now is not the time to be evicting folks. Now is not the time to really be letting folks fall through the cracks, because as we get out of this, we will be having a lot of challenges, and we will only be exacerbating some of our current challenges if we don't do right by our own. So Courtney, thank you so much for what you do. Let's see if we have, oh, and also ditto on the shout out to the Cooperative Council of Ministries. Like you said, a lot of the churches that are a part of that are in our district are very close by. They've been doing a lot of work for a long time, helping our unsheltered brothers and sisters, feeding them, helping volunteer at the center, and really helping them move the ball forward and hopefully taking some of the burden off of your plate and your folks.
We enjoy them very much.
So let's see. Chat is open in the Q&A. So if anyone has any questions for Ms. Tierney, please feel free to ask. I actually just got someone who messaged me through Facebook Messenger. They are asking about the Medicaid applications and how your folks have been sort of handling those. And you mentioned that obviously as we move through this, the state has sort of waived some of the renewal processes and stuff like that. I would imagine that's been helpful. But what should folks out there know, generally speaking, as they sort of look to be applying for Medicaid? Do we know if there's a sunset date on those waiver of renewals? What else can you sort of dig into in terms of that?
We don't know about when they may end that renewal waiver. The best way to apply is to go online and do an online application. There is also a phone number on that last slide that I had. Just understand when you do that and you feel contacting the state, and you are, but the application comes back to us locally for us to determine the eligibility for it. I might add, many of you will recall that Virginia expanded Medicaid. When they expanded Medicaid, they said that they felt, the state felt there were 400,000 people that would benefit from it. And in fact, over 400,000 people, additional people, adults, for the most part, healthy adults between the ages of 18 and 65 were the ones that benefited. So that has been a very positive thing.
That is very helpful. Thank you for that, Courtney, because that's obviously, as we know, we have some folks that now they're in the low income community, or they're just now recently eligible for Medicaid. Obviously, as you're well aware, last we started with Medicaid expansion. So obviously there's a lot of folks that are being served by that.
Sorry.
No, go for it.
No, I was just going to say the income level is very low. However, when someone has lost their job and they have no income coming in, it is unfortunate you can get to that low income threshold very quickly. It does include assets and what's in the bank account and so forth, but if you call or go through the online process, you'll get help and get worked through it.
Absolutely. Thank you for that. And so, yeah, Mr. Amato just said, this was a great and beneficial overview and a wonderful understanding of the PwC services.
Thank you. I would like to add, this is Public Service Appreciation Week. So I have to say a shout out for county employees and those in human services, Lisa's folks too. But in DSS, and I have it back here, it's usually called the Department of Social Services, but we're calling it Dedicated Strong Survivors. And we are hashtag Prince William Strong. So thank you very much for your interest tonight.
Yes, ma'am, absolutely. And as I given kudos to Brian and his team, same thing goes for you and your team, Courtney. I know that you guys are working a lot of long hours, especially now, even before now, but especially as you saw, I mean, people online saw the numbers. They are experiencing a much more robust workload and caseload than they had previously. And my hope is as we move through this and as her team continue to train people up and get people where they need to be, that we not only get to a place where we're helping folks, but also start to play some catch up in terms of being sort of behind in some of the services we are offering people as a result of Empower.
That'd be great.
Let's see. I don't think there's any other questions I'm seeing, but as with Brian, if folks have any questions that come up after seeing Courtney's presentation, just like with Brian's presentation, we will be able to provide her slide deck to everyone after this is over. Please feel free to reach out to my staff, and we're more than happy to partner up with Courtney and her team to make sure we get your questions answered. That being said, Ms. Tierney, it's always a pleasure. Thank you so much for all that you do. And yeah, definitely strong survivors. And we hope that we will get through this sooner rather than later so you guys can get some rest.
Yes, thank you. Thank you very much.
So that said, we are off to our final presenter, Ms. Lisa Madron, who is the head of our community services. And Lisa, the floor is yours.
Thank you. Good evening, Occoquan community, and thank you, Supervisor Boddye, for inviting me to be a part of this town hall this evening. Thank you also, Jason, Emily, and Julia for helping get us ready for this. This is rather new for me, but I'm very pleased to be here this evening, particularly with my colleagues, Brian and Courtney, as a human services agency too. Department of Social Services and Community Services sometimes can get confused, and yet we may share some clients at times. Our services are very different, so I'm very pleased to be able to speak to some of our services tonight. I'm just trying to get familiar with the slide. I will be talking about our services and treatment in community services this evening, the approved fiscal 21 budget requests by the Board of County Supervisors, and some of the impacts of COVID-19 on our services and our staff. Community services is the single point of entry into the publicly funded mental health, substance use, and developmental disability services. The county is mandated to establish a community services board by Virginia code, and Prince William Community Services was the first CSB to have been established in Virginia. As of last year, we celebrated our 50th anniversary, and now there are 40 other CSBs across Virginia. We are licensed and regulated by the Department of Behavioral Health and Developmental Services, and we serve residents of Prince William County and the cities of Manassas and Manassas Park who are affected by or at risk of developmental delays and disabilities, substance use disorders, and serious mental illnesses. We provide services in our two main offices in Manassas and Woodbridge, and in the community and in client homes. We provide treatment and we help connect individuals to other needed services. We educate and advocate and engage individuals into treatment services that can improve the quality of their lives and oftentimes transform their lives. We collaborate with community partners around service needs, and we promote recovery and self-determination, empowerment, and resilience. As you can see on this slide, we offer multiple programs. We offer treatment and services through these programs for individuals and their families, basically from birth through older adults. The two programs that are highlighted in green here are added as a result of the fiscal year 21 budget adoption. Our treatment services include outpatient therapy, group and family therapy, intensive clinical case management, day support and psychosocial rehab services, psychiatric services, employment services, and we offer specialty team services. We're mandated to provide emergency services for individuals experiencing a psychiatric crisis or may be in need of psychiatric hospitalization. We're also mandated to provide outpatient services, primary care screening services, same-day access assessments, and case management services. Community services has many needs, and we often run waiting lists for several of our services. Thankfully, this year, the Board of County Supervisors approved funding for some of our most pressing needs, and they are listed here. The first program, the Mental Health Co-Responder Unit with Police, is a new program that was added based on the results of a pilot program that we collaborated on with the police department. We paired an emergency services worker with a police officer for responding to mental health calls. When an officer responds alone, oftentimes this can escalate the situation. This can take up to 8 to 12 hours sometimes of an officer's time and lead to hospitalization for the individuals involved. What we found from the pilot was that in almost all of the calls responded to, having an ES clinician there who could intervene with the individual, help de-escalate the situation and address the crisis and get the persons connected to supports and services was far quicker, utilizing less of the officer's time and much more helpful to the individuals who were helped in a faster and kinder way. Intellectual or developmental disabilities. This program provides case management, which is a mandated service. Yet for those eligible for this service, that exceeds our capacity to provide it. So being able to support additional case managers and service coordinators to coordinate and monitor the services of the individuals, and particularly those that will be getting Medicaid waiver slots provided from the General Assembly, is very much needed and appreciated. May just happens to be Early Intervention Month, and our Early Intervention or Infant and Toddler program provides treatment and services like occupational therapy, speech therapy, education, physical therapy to infants and toddlers and their families who have a developmental delay. The annual growth in this program is around 7% per year. One of the outcomes for this program is that more than 50% of the toddlers that graduate from the program don't go on to require special education services. This funding will allow us to serve more infants and toddlers and their families and to address their delays and disabilities. Our peer outreach and opioid response is a team that allows us to continue to address the opioid epidemic and substance abuse challenges that we're facing in the county. This team began as a county pilot almost 2 years ago. We obtained a state opioid response grant that's scheduled to end this September. The grant uses peers to engage individuals in the community who are opiate and other substance users into treatment and services. And their engagements and connections have focused individuals where we've had the highest risk. Continuing this program will allow us to better engage individuals into treatment. New Horizons is our youth program, and there's a new high school that's scheduled to open the fall of 2021 in Bristow. This position will allow us to provide a clinician in the high school providing services in treatment to the students at this high school. We currently have a clinician in every high school in the county. The county board also funded the intensive in-home services program beginning January of 2021. This program expands our continuum of services for youth beyond outpatient and case management to provide the level of intensity and skill building services some youth need to be able to stay in their home or to return home sooner from hospitalizations or residential treatment. In addition to May being Early Intervention Month, May 7th, tomorrow, is Child Mental Health Day, designed to highlight the importance of mental health in youth. And I want to really thank our Board of County Supervisors, but especially Supervisor Boddye, for supporting this program and the need to expand the continuum of our youth services. The significant impact of COVID on community services that we've been providing has really been in our walk-in same-day assessment services, which we've had to stop and go back to scheduling appointments. We would frequently see up to sometimes 60 people. One day we had 95 people walk in for assessments prior to COVID. Clearly, we couldn't have people coming into the building in that number. And so we had to stop that, but we are still doing assessments, just appointments are having to be made. For the rest of our treatment and services, with permission from the Department of Medical Assistance and our Department of Behavioral Health and Developmental Services, and relaxing regulations, which were allowing us to increase our telehealth services, we've been really able to increase the engagement with the clients that we serve. We have exploded in our ability to offer groups to our youth and adult populations, and our staff are reaching out frequently to support their clients. However, we also have staff that are working in the office, in the community, and going into client homes when needed. We've experienced increased referrals in substance use disorders and the need for treatment services, particularly around medication-assisted treatment. And we've continued to operate our medication-assisted clinic in person 2 days a week. We've also continued to offer Revive trainings out of our clinic to help prevent overdoses and to provide Narcan. We recognize that this is a challenging time for our community, and our wellness and prevention specialists have been collaborating with various agencies and with Comcast around messages and online ways to address stress management, decreasing anxiety and isolation, suicide prevention, and Revive online trainings. And information about this can be found at our website. And my last slide provides information on getting to our website. I have an amazing staff who truly leans in to resilience when challenged. And although we have increased telework, as I indicated, we are working very hard in the community and in the offices and with clients. And in particular, some of our specialty teams, our emergency services staff, and our nurses are challenged as they frequently find themselves having to give injections to individuals or do assessments that don't allow them to social distance. Initially, we had some challenges with personal protective equipment and getting that for our staff, but thanks very much to the county and to Emergency Operations Brian's group, we have the PPE and the N95 masks that healthcare workers, because our staff are considered essential healthcare workers for the services and treatment that we're providing. We certainly have staff that are concerned about their health and the health of those they live with and what they're bringing home. And we value the health of our staff who are considered essential healthcare workers and work to help them maintain their physical and their mental health. They experience a lot of challenges because they're helpers and they want to support our clients. And we have had some clients who have confirmed cases of COVID. And we're working very hard to support those individuals and their families. For questions about community services or the resources on various topics, virtual support meetings that are happening, Revive training, suicide prevention, please go to the link for our community services website or call our office either in Manassas or in Woodbridge. Thank you. And if there are any questions, I'd be happy to take them.
Great. Thank you so much, Lisa. As always, just like with Courtney's team, you and your team are providing a lot of really vital services for our community. And I was proud to sort of help spearhead getting that in-home intensive program back into the budget, at least for starting 2021, because as I've talked to folks in the community, they are seeing a lot of parents going through some issues, having to basically raise their children now that kids are out of school, dealing with issues they necessarily didn't have to before. And we sort of all identified that as something obviously that wasn't an immediate need for right now, but looking into next year, and as your team ramps up the folks necessary to really make that program successful, I think it'll once again serve the youth of our community well and their parents. And it's interesting because I as you were talking about the telehealth and some of the other issues that Courtney was also talking about, both of you touched on the fact that the youth are actually really responding to it well. And so one of the questions that I got through Facebook Messenger here was about that. And have there been any, obviously the upside of that is obviously there's not so much travel time. Folks are able to sort of see each other immediately, and that we've seen the youth obviously respond well to that since they're used to seeing folks on screens and talking. How has that been in terms of the workload of your team? Is there any downsides to that? Is that, impacting folks? How is that sort of panning out with your team?
I think the only downside are sometimes the technological glitches that happen with Zoom or with WebEx or some of the technology. But for the most part, individuals are accessible. They are definitely willing and able, and oftentimes want to engage more often. So our staff are working longer hours in some cases to be available to clients, particularly because of the rise in anxiety related to COVID. But it's been great. It really, for our infant and toddler program too, one of the stories that was told was that we'll often have a physical therapist go into the home. And for a toddler, this new person in the home can be entertainment. But being able to zoom in, they're able to see some of the challenges or the behaviors or the issues that the parents are dealing with and talking about that they don't get to see when they're there. So it has been great. It's opened up a lot of doors. Definitely, we have 20 groups going on for our youth, the youth that have not been in schools, and they're on all kinds of different topics to really help and support the youth. We've got 12 substance abuse groups going on. We've got mental health groups going on for our existing clients, and we've been able to address some of the wait list because of being able to provide the groups. So it's been wonderful.
And this is Courtney. I would add, I think it's been great too. We have certainly found that people can be productive, and the not having to travel all the time in the car. For me, I've got programs all over the county, and there was a lot of time spent in the car, much less paying for the gas for it. So it's been very beneficial. I think we're learning a lot, and I think we're proving that county employees have integrity, can be productive, and we're getting the job done.
Excellent. So another question I got through Facebook Messenger, people like to Facebook message me. It's we touched upon a little bit during your presentation, Lisa, but it goes to both of you actually. So don't pop away too long there, Courtney. Are your folks, both your teams, are they well stocked with PPE? Do they have all the supplies they need, things like that? Because obviously we've heard that there's been shortage here and there in the hospitals. The reports change daily on the status of PPE in the state, the Commonwealth, in our county, and the community. But obviously your folks are part of the front line in some of these services, still making home visits, things like that. Are folks still well stocked in PPE?
For community services, definitely one of our priorities has been the N95 masks for those individuals that can't do the social distancing with the clients. And we have those and they're fitted. We are using them similarly to some of the hospitals, and that we're not throwing them away. Unless they're contaminated, they keep the N95 masks. And we just recently have gotten like a backup to that. Gloves have been an issue in terms of sizes of gloves, and we're getting the gloves. And we've got surgical masks that we're using for the clients that we're seeing and are coming in contact as a precautionary measure. I think some of the challenges have been, you know, with the changes in the media, many of our staff are sort of wanting all of it. Understandably so, just to be extra secure, and they don't really need all of it given the tasks that they're doing. So we're trying to get them what they need, have them feel secure with it, and then really utilize the higher level protective equipment for those that aren't able to do the social distancing that is really very helpful during these times.
And I would agree. What has been a challenge for me, I'm not an expert in isolation and infectious disease and in what kind of masks you use when. So we've all had to learn about that. And it has been a challenge, particularly at the beginning, because the equipment went to healthcare workers and public safety, and it should. And we all know there wasn't enough of it, but it took a while for those of us like Lisa and myself, whose staff provide essential services, for there to be a recognition that, wait a minute, we've got a whole nother group of employees that are in harm's way, that are going into homes, that are, you know, meeting members of the public who are vulnerable and therefore may be exposed. We have had outpouring from local community sewers who have provided homemade cloth masks. That has been particularly helpful because as it first started, everything was concentrating on staff, and we support that, but we also serve a lot of people. We have youth at the juvenile detention center, they need masks. We have people at the homeless shelter, people at the hotel, the overnight shelter that we are serving, and they deserve a mask too. So we have learned, you know, who needs the N95, who needs the cloth mask, and who needs the disposable surgical masks. That's taken us a while to get through all that and to have enough. I feel like that is improving greatly day by day.
Absolutely. That's helpful. And that's why I sort of pitched this to both of you, because like was just said, you know, we wanted to prioritize our actual, you know, definitely frontline folks in terms of hospital workers, doctors, nurses, folks that are dealing with folks who are the most extreme cases. But again, just to the point that both Courtney and Lisa pointed out, we have a lot of folks that are county staff that are currently still having to interact with folks person to person, make sure that they're being served. And the last thing we want to do is endanger our county staff, or to the point, endanger some of the folks that we're serving, not knowing someone's asymptomatic yet, what have you. So we don't want to exacerbate problems by not making sure that our own folks are equipped as well. So I'm glad to hear that you guys have sort of worked through those issues. And my hope is now that we're in a place where we've had to work out some of those buckets of what needs what kind of mask, should this, God forbid, happen again, or we see a resurgent, or we get any sort of other pandemic like this in the future, which is entirely possible, we have some of this stuff worked out already, so we're not reinventing the wheel. I just saw Brian pop up. Is there anything you wanted to share, Brian?
Yeah, so thanks for that. And just to add, that is absolutely one of the planning efforts that we're working with the team and the EOC on. We have placed several very large orders, and we know they're months away, and in some cases we're on allocation for vendors. So there's a variety of ways we're doing that. A lot of it's through some of the regional collaborative purchasing. So we're using the bulk buying power of all the partners in the National Capital Region. And some of the orders we placed early in the event are slowly starting to trickle in. So we're in good shape, near term, long term. Ms. Tierney mentioned just some of the challenges getting people fit tested and everything. And we just had a very large order of the fit test solution that's used for that process show up yesterday. So we are seeing a little bit of improvement in some of the supply chain. And we've talked with county leadership about the long-term needs, and we're going to be keeping much more on hand and kind of trying to streamline the single model number part of things so that we have more of it on hand moving forward. So we're, as Ms. Tierney and Ms. Madron mentioned, it was a little bit of a challenge just getting enough out there to start with, but we're quite comfortable with what we have and what's been ordered. So thanks for that question.
Let's see if there are any other questions. Yeah, there is. 1 second. And as the next question gets pulled up, I know that we sort of discussed this a little bit when we were doing our test run, but it's also my hope that as we get out of this crisis, we can help get some of those changes in policy that were implemented as temporary measures that have really helped your team be more flexible, not having to travel as much, see more people in a much more efficient manner. I'm hoping that we can make some of those more permanent. So, you know, we should be not only getting back to normal, we should be adapting to the new normal, which is being able to serve folks wherever they are, especially as we've talked about, you know, certain segments of the population you've been able to serve better as a result of these changes. So it's my hope that we can really work with our folks on the local, state, and federal level to make some of those silver linings a more permanent thing. And now the question has popped up in there. Is there a fee structure for community service programs? And if so, are they covered by insurance, Medicare, Medicaid, et cetera?
We offer a sliding fee scale, and getting services should not be, or affordability should not be a barrier to getting and accessing services. And that's why we often run a waiting list, because being a public agency, we often serve the folks that have no other alternative. They don't have Medicaid, or they have Medicaid, but they're limited Medicaid providers in the community. So they're coming to us, as well as those that have insurance come to us. So we do take insurances, and we work on a sliding fee scale to make it affordable.
Absolutely, and I think that that's a very key point, and that's why we still have advocated for deep investments in the services that both Lisa's team and Courtney's team are offering, because we have great community partners that are in the nonprofit realm, that in the private realm are obviously our private health insurers, our health providers are all part of the team. But frankly, there are just some folks that can't be served by those entities for one reason or another. Part of that is affordability. There are obviously just some organizations that they won't serve people either because their needs are too great, or because they don't have the means of really paying for that. And that's really where Lisa's team and Courtney's team really come in to be that ground level bedrock of the social safety net. And that's why, especially now that so many folks, as Courtney and I discussed previously, are losing their jobs, are falling into that lower income bracket where they may not be able to afford things they were able to afford before, that we have that net and it's being reinforced. That said, we have another question. Since telehealth is having such a high level of success, will telehealth continue being being an option post the COVID crisis?
I sure wish and pray that this will, and this is where the advocacy kind of comes in, because as it stands now, private offices or vendors in the community that offer outpatient therapy, for example, that don't go through Medicaid or DMAS for reimbursement, can offer telehealth from home to home or office to home. We cannot, through Medicaid regulations. And that's what's allowed us to do this, because DMAS has relaxed their regulations. Our state organization, the department, has permitted that. But when things go back to normal, that's not allowed. And just for an example, we have been able to do telehealth with psychiatrists before COVID, but that requires the psychiatrist, for example, may be at home or in one of our offices, but we have to have a staff person with the client in the office. That is really hard for the individuals that could really benefit from this service in their own home or in the community, like's happening now. So I would love to see this continue, because I think it would be beneficial, but it's up to the state and federal regulations.
Absolutely. And just for the folks at home, I see you popping up there, Courtney, just a second. So Lisa, could you remind folks on the phone and online what DMAS stands for?
Department of Medical Assistance Services. So it is the federal department that reimburses us for some of our services.
Courtney?
Just going to add that telehealth we are using it significantly with persons experiencing homelessness. And GMU, George Mason's University's MAP clinic, that is Mason and Partners Clinic, is so very helpful. They do work particularly for persons that are underinsured or uninsured. And they are doing the triage at the shelter at the Dale City Rec Center. They are helping us with those that are positive or in quarantine or very sick with underlying conditions in our hotel system. And they just stepped up to do it, and they do it via telehealth, and it is working really well, not only for them, but particularly for persons experiencing homelessness. They adapt to it very easily. So I'm with Lisa. I hope this will continue.
Right. And an interesting synergy there is how a couple of weeks ago, both on our side and the school board side, we're looking at expanding more areas in the county that offer Wi-Fi hotspots. So obviously the one sort of barrier to a lot of folks getting telehealth is access to a device that allows them to see folks, or access to a phone or access to Wi-Fi on their computers to access those telehealth, those virtual services. But we are obviously looking at ways to help expand our footprint in terms of Wi-Fi, internet access to the community. So as we move out of this, we are able to make those offerings. And what I will say is, just to reinforce it again, some of these relaxations of guidelines and restrictions are at the state and the federal level. And so obviously, once we come out of this crisis, there'll probably be some talk about, those regulations were there to begin with for sometimes really very good reasons. But this has shown us that we can serve a lot more folks in a lot more varied and flexible ways, not only for them, but for our clinicians and everyone who's helping them, and really help a lot of folks have a lot better outcomes. So that being said, obviously, once we get out of this crisis, we get closer to the next General Assembly session, I will be sort of working with both Ms. Tierney and Ms. Madron and their teams on working with our General Assembly partners and our federal delegation on how we can really streamline these processes, so we're having the best outcome for folks and we're being as most effective and efficient as possible with our delivering of services.
Thank you.
So I think that was the last question. At this point, it is 7:27. We are billed to have this open until 7:30. So Brian, Lisa, Courtney, thank you so much for joining us. Was there anything the three of you wanted to add before we wrap up?
Wash your hands, socially distance, use
Take
a
your
mask,
temperature.
take your temperature, be careful.
Yeah, and just as we look towards trying to get back to some sense of normal as a community, we just ask everybody to be patient and keep following the recommendations that the governor and the local officials are giving. We know everybody's kind of got cabin fever, and it's been a tough couple of weeks here. But as Courtney said, wash your hands, don't touch your face. Still telework if you can. Still practice social distancing. This will pass, but if we do too much too soon, then we could have some little spikes that we'd rather not see. So just keep being patient, and we'll be as open and honest with folks about information as we can be.
Absolutely. Yeah, so on that note, again, everyone on the phone and online, thank you so much for joining us. If you have any further questions, concerns, issues, our office is here. These three excellent public servants are here to serve you. We know that this has been a trying time for folks, whether you're experiencing some of the hardships, the direct impacts of this COVID crisis, or some of the ramifications on a ripple effect level, like you can't go, spend time the way you've wanted to. You haven't been able to see friends, family the way you've wanted to. We know that every segment of our population here in Prince William has been impacted by COVID in one way, shape, or form. But I also hope that, as with our county government, this has given folks a newfound appreciation for our frontline folks, whether it's our healthcare workers or the great folks in both our social services, our community services department, and our emergency response personnel who are really out there every day making sure that we weather this crisis as best as possible, and that, you know, we're not only setting the stage for us to have a recovery, but to make our community more resilient. So should things like this happen in the future, we're in a better place to sort of respond to it and stay healthier as a community and as individuals than we were before. That all said, again, this is recorded. We will be releasing this video on our website. We'll actually be slicing it up into each individual presenter as well. So if folks only want to hear from Brian, although there's really great stuff that Lisa and Courtney talked about, they can just hear from Brian. Or if they want to just hear from Courtney on her stuff, we'll have a segment on that. And the same thing with Lisa. We're not going to really chop up my part because no one wants to hear me talk. I have really great experts on here that could speak to these issues a lot better than I can. That being said, folks, again, thank you so much for your time. Stay well, stay safe. Lisa, Brian, Courtney, again, I cannot thank you enough for joining us tonight. We are very blessed as a community to have you serving us in the public sphere.
Thank you. Good night.
Stay safe, everyone. Have a good night.
Good night.